Hi, everybody. I'm here today with my friend, the Health Minister, Mr. Cameron Friesen, who is doing a heck of a job. And I want to congratulate all the people in his department and all our frontline workers across the length and breadth of the province for their wonderful support. And also say that in terms of help, if you're out there needing some assistance or help, or you'd like to volunteer to give assistance or help, please register at helpnextdoormb.ca, helpnextdoormb.ca. Over 5,000 people have registered to help, hundreds have registered to receive help and have been, and over 140 communities have been represented by people who volunteered. I would mention to you, if you're doubtful, if you're a senior and you're concerned that you don't want someone coming to your place to help pick up your groceries for you or a prescription, understand that this website is vetted and the people are checked by our justice officials to make sure that you're safe and not going to get scammed in any way. So I wanted you to know that. Almost 1 in 3 Manitobans in their lifetime is going to deal with a mental health issue. Today, we're going to talk about mental health. I've faced up to the challenges of depression at various times in my life, never so bad as when my mom passed away a few years ago. And you bottle it up sometimes, I did, but my family knew. That Christmas, my daughter made me this gift. It's called the Optimist Creed, and she hand-etched it and put it together. I think it's a beautiful gift. I'll always treasure it. It helped me, so I wanted to share it with Manitobans because it might help them too. It's just words and thoughts, but words and thoughts matter at times like these. I'm not going to read you the whole thing, but I'll read you some of it. I promise myself, it says, to be so strong that nothing can disturb my peace of mind, to talk health, happiness, and prosperity to every person I meet, to make all my friends feel that there is something worthwhile in them, to look at the sunny side of everything and make my optimism come true, to think only of the best, to work only for the best, and to expect only the best. And it goes on. You can look it up. It's called the Optimist Creed, and it's something that helped me when I needed that help. And that's what we're talking about today. Something that's going to help you when you need the help. Cameron, share this good news with the people of Manitoba, please.
First, we want every Manitoban to know how proud we are of them. Manitobans who are stepping up, as the Premier said, and making efforts to reach across the divide that COVID-19 is creating in our lives, in our families, in our neighborhoods every single day. We are proud of the compliance and cooperation and compassion that Manitobans are showing each and every day in these unprecedented circumstances. And we want to applaud, again, all frontline workers, people who are in healthcare, people who are in childcare, who are going to work and helping Manitobans and doing what we all need to do to flatten the curve. Pandemics, as we have recognized, bring a high level of stress and anxiety. And the health and the well-being of Manitobans continue to be our priority in this uncertain time. As the Premier said, we're so proud of tools that have been added like helpnextdoormb.ca. I understand 140 communities, over 5,000 people already registered in a matter of a few days. It's just stunning to see this display of goodwill by Manitobans. Most of us have never experienced anything like this. This is sustained and significant intrusions into the way that we live our lives normally every single day. And people are worried. People are worried about getting sick. They're worried about their jobs. They're worried about their families. They're worried about exams and school. They're worried about being isolated. They're worried about many things. Now, we know in this province there are many ways in which the province funds organizations that help. In-person consultations and phone and text consultations, groups like the Mood Disorders Association of Manitoba, groups like the Canadian Mental Health Association, and so many more. Many Manitobans recognize that just a few days ago, the Anxiety Disorders Association of Manitoba launched an anxiety support line to help people who are coping with the stress of COVID-19, and that's good. And we encourage Manitobans to use those resources. There's an impact from COVID-19 that we see. It's the closing of things. It's the inability to go to a sports game or an arena. It's the inability to go to the park and play. We see those things and we know them. But there is the impact of COVID-19 as well that we do not see. And it is equally real and equally important. It is happening in the way we are thinking, the way we are feeling, the way we are behaving. And this needs to be addressed as well. And that is why our government is proud to be adding an additional tool to help you out if you're feeling anxious about COVID-19. As part of our response to the pandemic, as part of our Manitoba Protection Plan, we are proud to be bringing a mental health service to provide online mental health counseling and services to people in their own homes. We are partnering with a company that is one of Canada's leading providers of technology-based human resources and mental health program delivery. We are creating therapy programs to help people who are feeling mild or moderate anxiety because of this pandemic, and we're making it easier than ever for them to get connected to professionals who can help. We are the first jurisdiction in Canada to be signing up for such a service. Manitobans age 16 and over are eligible to access the program. You can access the program through your smartphone, through your iPad, right from your home. And I would say it does not matter if you live in St. James or if you live in Beausejour or Verdun or the Pas, anywhere you are, rural, urban, remote, you have access to this program. We want to support you, and we want to support you while you are self-isolating. You don't need a referral from a doctor to sign up. We are investing $4.5 million in a significant mental health service for an unlimited number of Manitobans who can benefit. This service will be available through the province's website starting in only 2 weeks' time. Service is available in French and in English. This is not meant to replace existing services in mental health. This is meant to be an additional specific resource that we can activate right now. Our healthcare workers can benefit. Our child care workers can benefit. Anyone on the front line can benefit. Seniors at home can benefit. People at home in isolation can benefit. This support will be available to you in the coming weeks. Don't hesitate to reach out to avail yourself of the services that you need. This is just another initiative in and another step forward in our Manitoba Protection Plan. Premier, back to you.
Thank you so much, Cameron, and thanks again for your great work. It's not every generation that has the chance to do what you have the chance to do now. Manitobans have the chance to save a life. Follow the instructions and directions that are protecting yourself right now. Follow them diligently, and you can not only protect yourself and those you love immediately close to you, but you can protect others as well. Save a life. Follow the 3 Ps. Protect yourself, protect your loved ones, and protect our community and our province. Follow the recommendations of the Chief Provincial Public Officer. Practice good social distancing. And remember, if you need help, help next door, mb.ca, register. And remember, you're not alone. You have friends. You're in our hearts. You're in our prayers. Most importantly, you're in our deeds, too. You live in Manitoba, where we stand up for each other, and together we'll beat this thing. Any questions?
Thank you. We will first go to Bart from CBC Manitoba with his one question.
Mr. Premier or Mr. Health Minister, when are we going to see some more tangible, either financial assistance to Manitobans or more stringent measures to control the spread here in terms of either reducing the size of gatherings or further restrictions? It's the number one question Manitobans are asking.
Well, the answer is we've already stepped up a number of those restrictions, and there'll be more to say on that in the next couple or 3 days. And in terms of investments, you're seeing significant investment today that is the first of its kind in Canada, designed to protect the mental health and well-being of Manitobans at a time when they need that protection.
From CP, Steve.
Steve Lambert from the Canadian Press. Question for either one of you. I know there's a government online portal that is accepting and reaching out to businesses to supply some of the much-needed medical supplies. I'm wondering if the government has directly approached some of the large manufacturers, like New Flyer Industries, for example, to approach them directly and see whether, with their manufacturing capacity, they might be able to make ventilators and some of the other equipment that will be needed.
The short answer is yes, those conversations are on the move. Those plans are in motion, but I would say that the portal that we launched just a few days ago has been very successful in being able to capture those expressions of support. There are many people who want to help. This includes business, retail, manufacturers. We're pulling out all the stops to make sure we can get the equipment we need. Getting the equipment we need is a major part of our planning.
Manitoba small businesses and medium-sized enterprises, they've been stepping up, doing more than their part, and we should never take that for granted. We have a great business community in our province that's really, really ready to help, and I thank them for that, and we'll be using their help as we move forward to deal with this successfully.
We all have Patrick from CBC Radio Canada.
Hi, Patrick Foucault from Radio Canada. I guess I'll use my question to ask if one of you could provide a statement en français on that announcement.
Sure. Absolument, oui. Dans le cadre de notre réponse d'urgence à COVID-19, nous introduisions une option virtuelle qui est facilement accessible pour aider tous les Manitobains. C'est un programme de thérapie en ligne dans quelques semaines. Nous sommes très fiers d'emprunter ce service à tous les Manitobains.
Next from the city.
Hi, this is Stephanie. Mr. Premier, I just wondered if you could tell Manitobans what this tool will look like when they actually log on to it. Will they get to have a chat with the counselor right away? Will it be like a therapy program? What is it actually going to look and feel like for Manitobans?
So this is a program that's based on cognitive behavioral therapy, offering it in an internet or telephone environment. And exactly as you say, someone enrolls and they are connected to a therapist. I would also mention that person stays with the therapist for the entire 12-week duration of programming. This is based on a curriculum that someone follows. It is accessible. It is immediate. There's no wait period. You don't need to go to a doctor to get signed up. We've seen other examples of this across the world, and this is a significant way that we can be responding to address the mental health needs of Manitobans at this time.
Next, we have Larry from the Winnipeg Free Press.
Larry Kush of the Free Press. I'd like to get back to the issue of the group sizes and the limiting of groups. In some provinces, including Manitoba, it's like 50. In other provinces, like New Brunswick and Saskatchewan, it's 10. In Nova Scotia, it's 5. Could you talk about the pros and cons? What considerations are going into whether to keep it at 50 or to scale that back to, let's say, 10? What sort of thinking goes on making that decision?
2 points, Larry. First of all, the group size thing is a little more complex than might have just been outlined in the preamble there, but the fact of the matter is we're looking at that issue all the time and acting on the advice we receive from our senior medical people. I believe there'll be availability of our chief medical officer in the next couple of hours or less, and so those are great questions to ask Dr. Friesen. Certainly we depend on his advice and we'll be acting on it.
From Global, Brittany.
Brittany from Global News.
Premier Pallister, a lot of people are wondering about rent subsidies. BC announcing a $500 a month rebate for people for 4 months. Can we see anything like this happening in Manitoba?
We've had ongoing dialogue with many, many groups, Brittany. I can say that certainly we've heard from those who are representing the concerns of tenants and renters, not just residential, I should add, but also commercial renters because of the impact on small businesses that is being felt around the province. We've taken nothing off the table. We're working also very closely with the federal government in terms of design. We've given our input to the Prime Minister and to others, including the Deputy Prime Minister as recently as yesterday morning, on these issues. I would say this, we'll continue to work with our partners. There are numerous areas of need all over the province of Manitoba, right across the country of Canada, and there have been some programs that have been announced, some of which we have had direct input on that the federal government's responsible for, and I do expect more to be coming from the federal government in the next couple of hours, in fact, on some programs that may be relevant to your question and certainly the concerns of other Canadians and Manitobans.
Clay from CJOB.
Good morning, Mr. Premier and Mr. Friesen. Wasn't exactly, excuse me, I wasn't exactly sure what aspect of COVID-19 we were discussing this morning. My question was going to be, I personally know of friends who have lost their jobs. I know of friends who own businesses that have been forced to shut down. People are stressed to the max. I was going to ask what can you offer in a way to help these people, but you pretty much answered my question as to this new program that's been announced today.
Well, thanks, Clay, for the statement and for expressing very well, I think, the feelings that all of us have around the province. We've all got friends who are feeling stressed. We've got friends that have little businesses that they're not sure about their future. We've got people who are living check to check that are really concerned about cash flow. We've got families concerned about loved ones that they can't talk to as effectively as they used to or see directly. And you know, there are these fears out there. That's why this service is so critical and why it is important Manitobans know they're not alone. And I know that Manitobans are stepping up right now as we speak and helping. But we want to do everything we can to reflect the great values Manitobans have in the decisions we make. That's why we've designed and are announcing and will continue to announce parts of our Manitoba Protection Plan, because here in Manitoba we care about each other and we act that way. And we're going to continue to take steps to protect Manitobans as best we can, as we know people right across the province are doing as well.
From the Winnipeg Sun, Josh.
Hi, it's Josh Aldridge from the Winnipeg Sun. I appreciate this program, I really do, but I have a serious question about it. Do we have enough psychologists to run this program? So, in reports out not too long ago, a year or so ago, that we have maybe about half the national average for psychologists per 100,000 people. If we have an influx of people who are going to take advantage of the service, is there enough manpower to actually run the service?
The Premier likes to say that this government knows how to shop smart. We shopped smart on this. We did our due diligence and we did it high speed because it counts right now. I can assure all Manitobans that there is capacity here. There are over 5,000 trained therapists who are ready to help Manitobans, and there are plans to even move that service higher if need be. But remember, the Virgo report told us when we received that report, that assessment of mental health and addictions in Manitoba, that there was too little access to psychology and psychiatry services. And this helps that. This will help the wait time issues. It also helps when the Virgo report said too little access in northern, in rural, in remote areas of Manitoba. This bridges all of those distances, and also we know that it offers services before issues get too significant. Thanks for the question.
And in your own home. So you can stay self-isolating and stay safe and help others at the same time.
From CTV, Jeff.
Hello. This is a question about legislation. I know you're not sitting right now, but I believe the Restaurant Association is looking at expanding what they could do with takeout, like things like liquor. And I know you have the legislation on wine, I believe it was. Is there any thought to allowing restaurants and businesses to expand what they could move in a takeout scenario, with obviously most restaurants closed now and doing that?
Yeah, Jeff, the answer is everything's on the table, but more than that, the answer is that we're consulting with the very people that you just referenced in your preamble to make sure that we're making laws that balance the need to protect Manitobans as best we possibly can with the need for Manitobans to have the services and the goods that they need so they can keep living. And, maybe the analogy that Krista Friesen used in my discussion with her yesterday is appropriate here and may help Manitobans a bit to think of it this way. We've all lived through blizzards in this province. You got to hunker down for a little while, and we'll get through this. But right now, we've got to make sure we're safe and that we're protecting our most vulnerable people first and foremost. And that's exactly what we're after. That's what our priorities are. But our people, while they hunker down, still need goods and services, so we're making sure we're working with the chambers of commerce, the business groups, various advocacy groups to get the best possible ideas and bring them to bear to protect Manitobans, but to make sure that we protect their ability to live and to hunker down while we're hunkering down.
FM, Maddie.
Good morning. My question is in regards to how the matching with the therapist work. Will for people who call in, will they have the option of being matched with someone who is from their region? So a rural patient is taking a part of in this website will be matched with a fellow rural therapist. Will a First Nation person be matched with a therapist familiar with the treatment for First Nations people? How will that sort of work?
So there's a lot of details that we will be conveying to Manitoba in short order about how this service would work. And like I said, there's a matching process to make sure that one person gets a therapist that will travel with them throughout the therapy. You can stay with someone that you've developed that trust with to see you through that program. When it comes to matching rural to rural, I'm not sure if that will be in place, but as we've said, we're proud to be the first province that's bringing such a service. We're proud to bring a service that meets people at their point of need right now at home, and we're proud of the fact that this is available to an unlimited number of Manitobans starting as early as 2 weeks.
From APTN National, Brittany.
Hello, Brittany Hodgson from APTN National News. Mr. Premier, does Manitoba have any plans to follow suit with what the Ontario government did yesterday with issuing a moratorium on youth aging out of care during this pandemic? If so, why or why not?
Everything's on the table. We're looking at what we can do to maintain services at the highest possible level in the face of massive, massive challenges. And so in terms of issues such as the one you just raised, I wouldn't dismiss them. Our first and foremost concern is, of course, to protect vulnerable people, and the group you've just mentioned is vulnerable. So we're in discussion on dozens, literally dozens of issues right now, and these are issues that matter to all Manitobans. We're getting to them as fast as we can. That's what today's announcement is about. It's about mental health, but there obviously remain, as you've referenced, dozens and dozens of other challenges. We'll have more to say on many of these issues later today, and very likely every day thereafter, as we work together to face the challenges that COVID-19 is presenting us with. Just as Manitobans always do, we're going to do what the Bison inspires us to do, work together and face the storm head on, and protect our most vulnerable people as we do it. Thanks, everyone.
Thank you.